Look at that face. Well, there are babies too. It's something that our pets do though from time to time. They get sick on something. Some maybe eat too fast or get car sick. I can tell you a story about taking my dog off-roading in a Jeep. Terrible idea. For others though, getting sick might indicate a more serious problem. And here to talk more about that, Dr. James Speiser with Indyvet Emergency and Specialty Hospital. Hard to know because all dogs and cats sometimes from time to time will get sick and they'll throw up. But sometimes it is an indication of something much more serious.
Exactly. Well, as you say, most times it's just something they vomit once or twice during the day and the next day they're fine. But there are things that will indicate something more serious, such as if they're vomiting 4, 5, 6 times relentlessly, or they're gagging and nothing's coming up that many times, or if there's blood in the vomitus, or if there would happen to be vomitus that's very fetid and foul smelling, or if they're exhibiting abdominal pain or they're weak. All of those things can indicate that there's something more serious.
Okay. Also, we see some other pointers there. Loss of appetite here, dehydration here. What typically, when it's more serious like that, what are some of the causes there?
Well, there's lots of different causes. Certainly, as we see here, I have a garbage bag here.
Oh, yeah.
Garbage toxicosis, getting in the garbage, #1 cause.
That
Lots
happens
of things
a lot,
there.
doesn't it?
Absolutely. Feeding very, very high fat foods or giving bacon grease, that sort of thing, that can certainly cause pancreatitis and vomiting. Raw meat, feeding raw meat.
Raw meat is not good.
No, actually, if we culture that, we probably would culture E. coli out of that.
So not
Absolutely.
something you want to do.
Things like this, hair ties, so forth, can be foreign. Body that gets in the stomach. String, cats love to eat string, and then that can cause perforated bowel and so forth.
So if Rosie ingests that, she's not going to tell you. How do you know what to do in what situation?
Well, the first thing to do is don't give Pepto-Bismol or
The stuff that we would
Kaopectate.
take.
No, because that's really for diarrhea, not so much for vomiting.
Okay.
Next thing, take up the food and the water so that they don't go and try to eat more and vomit more, and just monitor the amount of vomiting that they're doing so that if they continue, you may need to go see a veterinarian. But if they don't, if the vomiting subsides, you offer water, small amounts frequently through the day, and then the vomiting subsides, then the next day offer them small amounts of food. 9 times out of 10, they'll get over it and will be fine.
Okay.
If they continue to vomit, then you should seek professional
Before we
attention.
let you go here, I understand you have a new app.
Yes, we do have a new app. Indyvet has an app that can be downloaded at iTunes or Google Play, and allows people so they have constant access to an emergency number or a website and so forth. So
the
yeah,
medications they take, all that good
Exactly.
stuff. Why not? Hey, Dr. Speiser, as always, thanks so much. Dr. Speiser with Indyvet Emergency and Specialty Hospital. If you want some more information, break down some more of what we talked about here, fox59.com is your resource. Just click links on the homepage. How's Rosie been doing? Okay?
She's been doing awesome.
She's so calm. She's so calm. Wish
She's
my
a
dog
good
was
dog.
calm like this. Yes, she is.
Well, I'll give her to you.
Oh, all right, let's go. All right, Jim, take it away.
All right, thanks a lot, Ray. We're at 9:17, and kind of a mix of sun and clouds. Really depends on which county you're in.